I have 3 daughters now of my own. And
Right.
so I'm definitely trying to take that mindset of, baby, the world's a tough place. People are going to constantly tell you no, and people are going to tell you you can't. But if you want it bad enough, and if you have that vision and that drive, you can accomplish it.
Welcome to the Dr. Crockett Show. This is where we go where the scalpel doesn't reach, usually, except today I have a very special guest on with me. She goes with me where the scalpel reaches every week, twice a week. She's my first surgical assist. I want to introduce you all to Lacey Aguero.
Hi, how are you guys?
Thanks for coming on the show today, Lacey.
Thanks for having me.
We are going to talk a little bit about stuff that doesn't have to do with the scalpel, though.
That's fine. Let's talk about it.
Because, we were talking in the OR the other day a little bit about what it's like to be working in this man's world and kind of the grit. Like, you're really known for having grit. You've showed up a couple days lately where I'm like, the men are staying at home sick and Lacey's there. Lacey's there working.
Gotta have that grit. You really do.
I'm so grateful. I'm so grateful for you showing up.
Good. Thank you.
So I wanted to start by you telling us a little bit about your background, how you became a first surgical assist, and you got some other really impressive background as a member of our armed forces, and I thank you for your service, but also just wanted to give you a chance to tell our audience a little bit about yourself.
Okay, so I will start with, I am not an original Texan.
Oh.
Don't get upset for me, but I am definitely, I feel like I have been initiated in. I've been here for about 18 years now. I started out, I joined the military while I was in high school.
And where did you grow up?
I grew up in Mississippi.
Oh, yes. Oh, yeah.
Right there on the coast. So, coastal girl. I joined the military pretty early, and then I got to travel a little bit and got stationed here in San Antonio, Texas. And from there is kind of where my medical career took off, unbeknownst to me that that's the direction it was heading. I had no clue what I was getting myself into. But
as so often happens in life, right?
Right. So 18 years later, here I am, exactly where I think I should be. First assisting. I get the pleasure of helping you.
Thank you, and a lot of other amazing surgeons in town.
Yes.
We really depend on you as our right-hand woman.
Yes. I'd like to think I'm an extra set of eyes and ears that benefits you guys and the patients. So
completely, and you're pushing the boundaries on the licensing and the development of first surgical assist. Can you tell us a little bit about that?
So not a lot of people know what a first assist is, but I guess in retrospect, if you think about it, your surgeon technically needs more than 2 hands to help with surgery. I mean, there's a lot of people involved, and we get the pleasure of coming in and helping you and making sure that that surgery is successful.
Yeah, so talk with me a little bit about, I know I've heard this, I know how this goes, but our listeners don't know, like, how did the position of a first surgical assist develop, and where is it right now? Where is it going? Where are you helping to push it?
So traditionally, when it came to surgery, a lot of surgeons were using each other during surgery. And that's excellent. You always want more hands, more eyes to help with surgery. However, it was taking away a lot of time in clinic. And so I was initially a surgical tech. And because I got to be there and present, over the years, we developed more skill set with you guys. We were learning from you guys. So institutions came forward and decided to do secondary training, and those that could would go back and get retrained and requalified to be a mid-level provider. And doing so, we get to help you guys perform.
Yeah, so then they kind of grandfathered in people that were starting to just operate, and then there became a certified program, and now there's a higher level of licensure.
There is. So there's grandfathered in first assists, those that have been doing it long enough to where just naturally they have been what you would call secured in their position. There's certification for first assists, which shows that you've gone back and you've received some sort of certificate showing that you've received training to do our position and help. And then there are few states, but we're trying to expand, There are a few states here in the U.S. where they give you licensure or registrations.
And the licensures are actually under the Texas Medical Board in Texas, aren't
And
they?
here in Texas, it's through the Texas Medical Board alongside the surgeons.
So the licensed first assists like you are now at a level that's more like our mid-level providers, like a PA would be for a clinic.
Yes, correct. So we get to function alongside of you and independently within reach and within scope.
You have your
with
own
the license.
responsibilities. So, you and I have been through thousands of cases literally together in the OR. The main thing I wanted to talk with you about today was grit and grace. That's kind of your thing.
It is.
Grit and grace.
It's my thing. Yeah. Yeah.
So tell me just a little bit, tell our audience a little bit about some of the instances where you've had to have grace under grit. And, when you and I were talking a little bit before the show, we were talking about the grace is not just to extend to others. It's like the grace to ourselves because we're so hard on ourselves, right?
Yes.
So tell us a little bit about how the military taught you grit and grace.
So growing up, I always kind of knew that I was going to join the military. My father was in the military, and then one of my siblings, she has cerebral palsy. So that took not a lot of time or attention away, but it was just, I knew if I joined the military, I was going to be able to provide, I guess, better for her and my family.
Wow.
So I made that decision early on. I enlisted my senior year. And I got to travel and experience all different kinds of cultures and people from, all kinds of corners of the world.
What a great experience, especially at that young age.
Very young. And so honestly, that was my first time away from home. I'd never traveled before. I'd never been on a plane before. And then I just kind of threw myself into it. So I guess with the grit, it came early on with the mindset of if I wanted it done, I knew I was going to have to be the one to do it.
Very self-aware and
Very
self-capable, and you've got your own back as well as other people's back.
Yes, and so then getting to experience, all these different people with different backgrounds and different cultures really gave me a sense of, okay, well, I'm not alone in this thinking. I'm not as alone as we tend to get in our head.
Right.
And so taking that mindset, it's always just kind of been like, okay, well, regardless of whatever the circumstance may be or the problem, the mindset will be, there's always got to be an answer. Is it going to be an easy one? No, they're not always easy, but there can always be an answer. And you usually can always get the answer you want. And so the military has kind of taken that perception for me and put them in context. And I've been able to take it and translate it over to a civilian mindset. And within that, it's giving me a little bit more grace because not everyone gets to get the exposure, but you really do kind of go from an extreme mindset of a black and white, this is the mission, this is what's got to get done. Oh, by the way, you're a female. It might need to be altered a little bit for you. And then you get on the civilian side and it's like, but wait a minute, I have all this exposure and all of this training and I can.
Right.
And you don't usually on the civilian side of things, you see a little bit less grace, at least from my perspective.
So, as we're sitting here talking, I'm thinking like, I wonder how I would really define grit. Like, I know what I think of it. What
do you think of it?
I'm thinking of it kind of like when you and I are in a case and we're tired or things are going long and it's just hard. The grit is just put your head down and get it done and do the excellent job anyway and push through. Mm-hmm. It's kind of that, even under pressure, you just do it.
Yeah.
You work the 36-hour shifts when you're training. I don't do that anymore. But yeah, you do the 6 cases on the day and because they just have to get done.
Yeah.
Or you work when you don't feel great because it just has to get done.
Yeah.
So, what are other examples in your life where you had that?
I would probably say on a home environment growing up, everyone has their obstacles. Everyone has family history. I would definitely say it was me and my 2 older sisters for the longest. And then about 14, 15 years later, my brother came along. And it was primarily the family dynamics was me, my siblings, and my mother. So there was a father presence. It wasn't always present. So the grit there of knowing that, okay, well, these are the things that my mother's doing. You just naturally in a home setting want to contribute or help. So there was that grit, the grit of trying to help maintain the family at home.
So was that something that your mom required of you, or was it just something that you were like, I've got to help out?
It was never required. No, actually, it was just a mindset, which is kind of weird because you want to know where that mindset comes from initially, right? That
that's
drive.
Yeah, where did it come from?
That's a good question. I'm still trying to figure that one out myself.
How can we instill that in our next generation?
But, I have 3 daughters now of my own. And so I'm definitely trying to take that mindset of, baby, world's a tough place. People are going to constantly tell you no, and people are going to tell you you can't. But if you want it bad enough, and if you have that vision and that drive, you can accomplish it. And I don't think there's been one thing that I haven't set my mind to that I haven't accomplished. Now, it never happened overnight, but...
Yeah. Wow. That's stunning.
Yeah.
Not very many people can say that, Lacey.
Really?
Yeah, I don't think so. I think people give up and they find other pathways. And so that's some tenacity as well as grit.
And looking back at some of my home setting too, and I remember, certain situations that would play out. Okay, like the father presence, he could have been present, chose not to, and that's okay. No resentment there, really. But I would always take that situation and want to analyze it and be like, okay, well, what would I do? And how could do I want to do this when I get older? Or is this something that I can change? And I've looked at every situation like that. Is it something I want to do? Is it something I can change?
Wow. That takes some self-awareness at a young age to do that.
Yeah, it does.
The other thing that I'm seeing, and we see it in the OR with the younger
staff
that come in, the grit and the determination thing is something that, I'm not sure I had it when I was their age either. I think it's something that comes over time when we're able to see that there are really great things in life. Like even like this, the studio took a tremendous amount of grit to get to where it is.
And you've done such a great job.
Well, thank you. I appreciate that. But I thought it was just going to go up and we were going to go live in a couple of weeks. And the number of failures, I keep joking that we're failing forward, like fail faster to get to the right place, that just to get to this place where everything was set up right and we're able to have this conversation and share it with an audience. What took like 4 months of grit and just not getting discouraged and pushing through it and just not working and finding somebody else to help and figuring it out. That's interesting.
I had heard a quote not too long ago, and I wish I could give credit to where it came from, but it was, I might not always win, but I never lose, I learn.
Oh, dear. And
so that's like a really good way. And that's kind of how I've always looked at things. Well, I don't think I lost. I definitely learned something. And then now it's just, let's throw it on my resume. Let's add that to my next experience.
The next thing. So where are you going next?
I really want to push for LSAs to be a little bit more noticed, definitely regulated. The licensure is, I think it's a must in the OR. I mean, I would hope that, the patients and you guys think so too. Right now, that's kind of my goal, is just to bring more awareness to the profession.
I think that's admirable. I'm going to add that I want to see us training more of them.
Yes.
I think there's a real need for them to have the higher level of training. And I'm hopeful that you and I will be able to work together to build that.
To build it. Yes, absolutely.
So
you mentioned how grit and grace is kind of this theme. So the backstory for me right now,
I love a good backstory,
is we all kind of pick quotes and we have our own motivational phrases and stuff that get through us. Recently been going through self-evaluation. We all get there at some point.
Thing. Yeah.
My sister-in-law actually had given me this hat.
This cute little hat.
Right? Isn't it? It's adorable.
Gosh. How cute that is.
She'd given me this hat and it says Grace and Grit. And when she gave it to me, unbeknownst to me, she's like, I just want to let you know that I've been watching you, and you give yourself so much grit. You're full of it. Don't ever doubt that you have the grit. But I do think you should work on giving yourself just a little grace.
Lacey.
I know.
Yes.
She said this, of course, that brought me to tears. And I was just, it really hit home. And so I was like thinking we all need to give ourselves just a little bit of grace.
We do, that compassion. We all work hard as moms, especially. And
Yes.
we're so hard on ourselves. I was raised in that mindset too of perfectionism or, very hard work ethic. And, you work hard to get what you want and all of that. And the downside of that is not giving ourselves the compassion and recognition, the grace for what we've done. But that's the flip side of it, isn't it?
Yeah. As women, working, momming, if you're married, I mean, it's so easy for us, I think, to want to do it all.
Yeah.
And to want to be perfect at it.
Well, and sometimes when we're sitting and resting or taking a bubble bath or whatever, we're thinking, oh, I ought to be doing more.
Yeah.
But I think we miss that the receiving, the resting, restoring, receiving that feminine energy is doing.
Yeah.
It's a different kind of doing. And unless we do that part where we're resting and restoring and sleeping and taking care of ourselves, we can't do
it's a very important part of us to function. I just don't think we overlook it a lot.
Yeah, we do.
Yeah.
Well, maybe we should remind each other over the OR table a little bit more often.
Yes. Give yourself some grace, Doc.
Thanks, Lacey. You too. Thanks for being on the show.
Thanks for having me.
It was awesome.